Welcome to the Health Impact Hub's podcast, The Hub. This is a space where we highlight the voices of those shaping the future of health, not just in clinics and hospitals, but across communities, classrooms, and policy spaces. Each episode, we talk with leaders working at the intersection of medicine, public health, and policy to tackle some of the most pressing issues of our time, whether that's through advocacy, innovation, or grassroots action. Welcome to The Hub.
Good afternoon, everyone. My name is Emmanuel Scaife, and I'm representing the Health Impact Hub at UC Riverside School of Medicine. We're a student-led initiative dedicated to bridging the gap between health policy and clinical practice by fostering collaboration between the School of Public Policy and the School of Medicine. Through this podcast, we aim to engage in meaningful conversations with local leaders and advocates about the policies shaping healthcare in our communities. Today, we have a very special guest. Assemblymember Corey A. Jackson, DSW, MSW, was elected to the California State Assembly in November 2022 to represent the 60th Assembly District and was re-elected for a second term in 2024. He has served as chair of the Human Services Committee and currently chairs Budget Subcommittee number 2 on Human Services. Before his time in the Assembly, Dr. Jackson was a member of the Riverside County Board of Education and was the founder and CEO of SBX Youth and Family Services, a nonprofit dedicated to breaking cycles of poverty and violence through mentorship, education, and community organizing. His work in advocacy has focused on youth justice reform, racial equity, and expanding access to essential social services. One of his notable achievements was contributing to historic settlement against the unconstitutional Youth Accountability Team program, which criminalized minor adolescent behaviors, disproportionately affecting communities of color. As a legislator, Assemblymember Jackson has championed policies focused on improving health equity, juvenile justice, housing access, and social services. His legislative efforts prioritize communities in need, aiming to create a more just and inclusive society through policy changes that address systemic barriers to success. Let us please welcome the member representing the 60th Assembly District of California, Dr. Corey Jackson. Thank you.
Thank you for having me.
Thanks. Was that about right? Was it a good intro?
Yep, you're good.
That's good. Okay, so I guess we'll go ahead and get started with a few questions. First, your background includes social work, education, community organizing. How have these experiences shaped your approach to policymaking?
I think the most important part is that the region that I represent, I've grown up here all my life. And just like many of us who have grown up in poverty, mostly raised by single women, and have had a well-rounded life, I think the more life experiences, the more diversity of your experiences helps you to have a more holistic view of, number one, what does it mean to be healthy, and our role and responsibility to ourselves, our families, and then the community as a whole. And so whether it's in my time in education, whether it's me serving as a high school student on the Rialto School Board, or as a Cal State San Bernardino student sitting on the CSU Board of Trustees, being appointed by Governor Schwarzenegger, and of course, me going on my own education journey from my bachelor's and 12 years later, going back to get my master's and then my doctorate from Cal Baptist University in social work. All of those things are enriching experiences that I've been fortunate to have. And then, of course, my work in government and the nonprofit sector, which I think has been most invaluable to understand the everyday experiences and struggles of the next generation.
Wow. So how has social work impacted healthcare? Your views on it?
You understand all the different things that impacts health, right? It's not just per se what you eat, but it's also the environments in that you grow up in, and the systems you have to interact with can either strengthen your health or it can be an impediment to living a healthy life. And of course, when we think about health, we also need to make sure that physical health and mental health are in the same category. And if you have poor mental health, you will have poor physical health as well. And so how do we make sure that systems are helping you be more healthy, keeping you in a stable situation so that you can make sure that you have opportunities to chart your own course on thriving, as opposed to being stuck in survival mode? Bad things happen when you are in survival mode. Bad things happen when you are in a state of crisis. So understanding social determinants of health, understanding the critical impacts of ACE scores, all of those things contribute to your health and well-being.
Wow. So, for those who may not be as familiar with your work, how would you describe your mission and priorities as an assembly member?
Wow, my specialty is macro social work. So it's really about systems and policies that really affect the day-to-day and long-term success of a particular population. The key question that I'm asking myself, that I have started asking myself this year, is what does a 21st century social safety net look like? We are still operating off of, quite frankly, safety nets that were started in the Depression era. Since FDR, we're still operating off of those. And they have not been outdated. You're talking about at least 30, 40, 50 years. And so the question is, how can we call what we have a safety net when you can be a part of the safety net and still fall into homelessness? You can still be on the safety net and still not be able to find healthy and high quality food every day. So the idea is what we have right now is a survival program. But my mission is, how do we create thriving programs? And the second part of that is, how do we create the 21st century path of opportunities for the next generation? Because those path of opportunities need to be to ensure that we have healthy environments for our young people to grow up in. But then also, what systems do we need to make sure that they have an opportunity to break cycles of poverty? And we also know poverty has ripple effects when it comes to health, not only to the individual, but to the family and to the community as a whole.
Wow. Considering being at the forefront, what has been the most rewarding aspect of serving in the California State Assembly so far?
The most rewarding things are when you are battling and begging and pleading, and you actually can squeak out some successes at the end of a year. To be quite frank with you, I think that my most prized bill that I've been able to do and create in terms of law is the bill to stop the banning of books. I think to achieve that in my first year in office, I'm not sure if I'll ever be able to beat such an impactful bill like that, to meet history the way we did, to say not on our watch, and then pass on the battle to the next generation when it comes. Why is that important even to health, though? I think what's important is this, is that to be able to tell your own stories, to be able to preserve and pass on ancestral knowledge and stories is important. Why? Because our ancestors embedded healthy practices in the very stories to be passed on from one generation to the next. It is those Anansi stories. It is those other enriching stories that our ancestors have told, that told us What does it mean to be healthy and how to stay healthy? What does it mean to be in balance? How do we recognize when we're out of balance? And when we're out of balance, what happens? We start creating negative habits, unhealthy habits. And when we create unhealthy habits, we start to go on a path where our life expectancy becomes shorter. We have high blood pressure. We have higher rates of diabetes. We have all of those things, right? And of course, mental health effects in terms of depression and anxiety, isolation, and all of those things. So when all of those things are said and done, having free access to the stories that we tell ourselves to be able to stay healthy are equally as important as making sure that we have access to health and physical and mental health services in our community.
Thank you. And speaking just so much about health in general, we'd actually like to highlight one of your most impactful initiatives. The Save Our Babies campaign addresses a pressing and deeply personal public health issue: Black infant mortality in the Inland Empire. How would you describe this initiative?
We're at a crisis, and we've been at a crisis for such a long time. The likelihood out of any group, African Americans have the highest chance of our babies not being born at all. And if they're being born, still dying in infancy. And not only that, not only is there a greater chance than any other group for the infant from not surviving, but from the mother not surviving as well. So what does that mean? And just from a village standpoint, there ain't no village if there ain't no babies.
Yeah.
And so we are in emergency mode. And so my charge as someone who represents the largest African American community in the Inland Empire is that what do we need to do to organize ourselves and organize community-based organizations to wrap our minds and our energy and our resources around our birthing population and ensure that they have the knowledge, the services, and the support that not only the mother needs, but also understanding that their life partner, their father, what is their role in ensuring that both the mother and the baby is being supported in a healthy way. We have to reinstitute everyone's role in the family unit and their responsibility of doing these things. And the Saving Our Babies campaign is really about convening community-based organizations and community leaders into understanding the resources that are available, and then together ensuring that our members of the African American community are aware of it and have easier access to those services.
It's so important, everything that you just talked about. Can I frame everything with some statistics? So in the Inland Empire, the statistics highlight a severe inequity. In Riverside County, Black infant mortality rates stand at 10.1 deaths per 1,000 live births, compared to countrywide of 4.5. In neighboring San Bernardino County, the disparity is even greater, with a rate of 11.6 per 1,000 live births. And it just really contextualizes the importance of the work that you're doing, promoting awareness and education. And could you tell us a little bit more about the campaign and your role specifically within it?
Sure. So I act more of a convener and to ensure that it's just like what we experienced in the pandemic. If you don't have trusted messengers, if you don't have people on the ground, government cannot reach the populations they want to serve. And so I help try to bridge that gap as a trusted messenger of many African American leaders and Black organizations throughout the region. When they can't access them or get in contact with them, I help bring them together. And then I also help support community events and information to make sure that it gets to everyday families here in the region. And so, for instance, helping to reach out to the African American community in Coachella Valley and be able to set up events and set up information so that those African American families have access to those services. And so sometimes it's really, even just from a public health point of view, sometimes you don't have to be the practitioner. We all have a role to play in increasing the health and resiliency of our communities.
So what I'm hearing then is coalition building is really important.
Coalition building is very important, as well as being a connector. I'm reminded of the book Tipping Point, which is a great book, and there's a lot of best practices in terms of public health. And that whole idea of the whole spoken wheel concept, that there's really a few people that are connected to a whole greater network of others. And public health is helpful in understanding that if you can get connected to key people who are those influencers in the community, you know, those people who just know everybody, if you can get connected to them, it makes it a whole lot easier to educate people and get information to the right people. And so I'm one of those connectors who actually know other connectors. And so just from a point of view of me, not just coming down to say, this is what you need, but it's really about connecting people on the ground so that they can talk about what their needs are as experts in their own lives.
That's wonderful. So the relationship aspect is important, but there's also another aspect. There's a monetary and a financial one. What are the biggest challenges in securing funding and support for mental health and infant health initiatives? And how can future physicians and policymakers advocate for sustained investment?
I think the greatest challenge is California is the most populous state. And because we are the most populous state, that means we have a huge population with huge who are very diverse from one another, have very unique needs. And at some point, the resources of the state runs out. And so the question becomes, what gives us the best bang for our buck? And the biggest challenge, especially having a state budget being as it is, meaning there's a lot of booms and busts all the time. One year we have surplus, the next year we're in a deficit. So having sustainable funding is hard to do in California's progressive tax system. Number one, how do we make sure that we provide as much stability as possible in terms of our health systems? The good news is that when it comes to the protection of all the infrastructure that we stood up during the pandemic, we've done a good job of preserving that for the most part. We have also done a good job of making sure that we continue the investments in terms of the Black infant mortality programs. Can we do more? Yes. Do we have the resources to do more? Sometimes. And I think that's the problem, right? And the only way, and we're already a high tax state. And so it's hard to convince people to be willing to pay more taxes to do more programming because the need will never end. So communities need to build their own agency to be able to do it, which is why we're focusing on incorporating or recruiting already existing community-based organizations who have found ways to generate their own resources to get in the fight. And it doesn't even matter at this point whether infant mortality, infant health is a part of your mission statement. It's time for all hands to be on deck and all of us to use our resources and our influence and our infrastructure to help address this crisis.
Wow, thank you so much. And thinking about that, our student organization, the Health Impact Hub, we seek to bridge the gap between policy and medicine. From your experience, what are the most effective ways for physicians and policymakers to collaborate in improving healthcare?
One of the biggest problems with serving a population is that our professionals and our departments are continue to operate in silos. And we need to continue to work to create these multidisciplinary teams, for a lack of a better term, to come together and say, what do we all do to serve this one person? And how can we do it better with sharing information, sharing best practices, and being able to make sure that people have access to timely and individualized services that they need? And how can we make sure that we're working together to not get in each other's way, but we're actually able to enhance what's being done? So if one of us does a home visit, that one person then unlocks the resources of everybody else, instead of saying, oh, you're going to have to go call this number to get that. Oh, we don't do that. We need to, right? We need to create more one-stop shops, no wrong door processes, which is what I'm working on right now, to be able to make sure that everyone can come in at what they do best to serve the same people we all serve in one way or another. So what I have agreed to do is to help convene all of these different services and professionals so that we can cross-pollinate better and be able to, so that community health workers are in the same room as pediatricians and public health professionals and nurses and doctors, right? So that they can all share from their point of view, and doulas, to be able to share what they are seeing and be able to help each other problem solve based upon their own strengths.
That's wonderful. So even, someone like me who's a medical student, I'm still going through training. We can still be a part of that conversation, is what I'm hearing you're saying. That it's just building the relationship with others. That's the foundation for lasting and great change.
Absolutely. And your awareness and your training and your exposure should not be dependent upon which rooms you are and are not in. The most innovative ideas, the most innovative practices are really being formulated in some of these more informal conversations and all that stuff. And usually you will never see it until it's published
Mhm.
a year or two later. But what if you as a student are able to get in that room of those who have the most expertise in trying to solve the most complicated and messy problems of the day in a community, right? Then it actually enhances your availability to be the best physician as possible.
Thank you. Thank you so much. And as we actually inch a little bit closer to our time, is there anything else that you'd like to say about the future of the Save Our Babies campaign? And what are the next steps do you see?
I am deeply worried about us not being able to set up the next generation for success like so many other generations have done for their children and their grandchildren. And if we do not act quickly in shifting our systems and shifting our policies and resources to hyper focus on setting up the next generation of success, then we will be the first generations to fail in that sacred responsibility. So Saving Our Babies campaign is a part of us setting up the next generation for success. If we are not creating healthy infants, producing healthy babies, and ensuring that they have the multi-systems of support to live healthier pathways into adulthood, then we are not setting them up for success. And everyone needs to find their role that they can play to ensure that happens. So the next steps are really just continuing to bring people together, continuing to outreach into communities and leaders who may not know about it or understand what role they can play in it, to make sure that we can set them up for success to do their part.
Thank you so much, Dr. Jackson. And thank you for taking the time to speak with us. I know you're very busy, so I don't want to hold you over than the time we have allotted. But is there anything else you wanted to say or to share before we log off today?
Public health and health in general is all of our responsibilities. What we do every day, how we interact with people every day, can actually make people healthier, or it can put up more impediments to being healthy. So let's be careful about how we treat each other. Let's be careful about the decisions that we make every day, and making sure that we take advantage of every opportunity and every learning opportunity and every invitation of engagement to do our part, because it takes a community to make sure that we all are healthy together. Thank you for having me.
Dr. Jackson, thank you so much. All right, have a wonderful day.
Thank you.
Thank you for joining us for this episode of The Hub. If you enjoyed this conversation, please subscribe and share it with others who care about the intersection of medicine, policy, and community health. You can find us on Spotify and YouTube. To learn more or get involved, follow us on social media at Health Impact Hub. Until next time, thanks for listening. Music by Drake Maestas.